Today, we are talking about H. pylori, a hidden gut infection that could be holding your health hostage. If you've been eating clean and working out and your symptoms still won't budge, this might be the reason. Most people have never heard of it. Most doctors don't test for it, which is a huge problem considering how common this infection is. That's why I'm going to walk you through everything that you haven't been told about H. pylori, from why it's overlooked, the impact it's having on your health, and the exact process that we use in our clinic to get people results. Because the real reason why you may not be getting better might be hidden in your gut. We see this play out all the time in our clinic. So if you're tired of feeling stuck, if you're tired of trying things that don't work, this is for you. So let's start with the symptoms, because let's be honest, most people are walking around with this infection and don't even know that they have it. It's not obvious. It's not going to hit you all at once. It's much more like a slow bleed. You start feeling a little bit worse over time, and then pretty soon you recognize that your normal isn't normal anymore. You might be bloated after meals, feeling nauseous for no reason, frequent burping with acid reflux, you got that heartburn in the stomach. And here's the symptom that impacts people the most. You are tired, exhausted all the time. Not the kind of tired where I didn't get a good night's sleep last night. It is the dragging throughout the day, the entire day kind of tired. So then what happens? You go to your doctor, tell them your symptoms, they run some labs, they tell you, oh, it's your thyroid, or you're depressed, or here's a pill for the acid reflux. And yes, that diagnosis might be correct, but nobody's asking the question, why did that happen in the first place? What is the root cause? You see, that's what gets missed. I see this play out in my clinic all the time. People come in and they have diagnosis for an autoimmune condition, whether it be rheumatoid arthritis, psoriatic arthritis, Hashimoto's, Crohn's disease. Maybe they have chronic inflammation, they're feeling depressed, and they're taking this medication, which their diagnosis is correct, but nobody's asking the question why. Which means you have to ask the question, what if it's not just a general irritable bowel syndrome or Hashimoto's, but what if it's something deeper? What if the H. pylori is triggering the inflammation, which causes the autoimmunity to occur, which leads you to the diagnosis? And your body's been stuck in this reaction mode the entire time. I've had many clients come in with autoimmune conditions, and we keep taking a stool sample on them to figure out what's really going on, and what keeps showing up? H. pylori. So maybe the reason why nothing happens when you cut gluten, take a fish oil, or take an adaptogen for energy is because the infection is actually happening what we call upstream. You might just be infected, and the worst part is people will walk around like this for years and never get tested. Because this infection doesn't show up on standard labs, and unless if you're vomiting blood or have some other internal bleeding, they're not going to test for it. And we'll talk about why that is in the next section, but first, let's go ahead and discuss what this actually is and why it's way more dangerous than a lot of us have been led to believe. H. pylori stands for Helicobacter pylori, and it's a spiral-shaped bacteria that will actually burrow its way into your stomach lining. Most people catch this in childhood, licking the handrails at Disney World, and it will live inside of your stomach for decades, flying under the radar, silently messing things up. Right now, about 50% of Americans have H. pylori, and if you're over 60 years old, that stat goes even higher. But here's what's most dangerous. Once H. pylori gets in, it doesn't just sit there. It burrows its way into the stomach lining, and it starts to break things down. First thing it does is it starts lowering your stomach acid. Now, you obviously need that stomach acid to digest food and absorb nutrients, but when your stomach acid is low, your H. pylori is going to thrive. That's when you're going to start losing the ability to absorb vitamin B12 and iron, which those two nutrients you need to absorb oxygen, deliver energy to your brain and the rest of your body. And once B12 and iron start dropping, you end up with pernicious or iron deficiency anemia, which the number one symptom for both of those is fatigue. So if you've been told that your iron is low and your solution is to just supplement with more iron, you might be trying to fill a leaky bucket. You have to fix the absorption problem first, and what might be standing in the way of that absorption is the H. pylori. But it doesn't just stop there. That infection will also cause chronic low-grade inflammation, and that inflammation just doesn't stay in your gut. It can move into your joints and you can get diagnosed with rheumatoid or psoriatic or osteoarthritis. And remember, you might actually have osteoarthritis. However, it might be a result of chronic inflammation caused by the H. pylori. And that same inflammation will turn around and impact your thyroid. It will stop the conversion of T4 into T3, which is your energy producing thyroid hormone. So when you put all of this together, you're bloated, you're losing hair, you're gaining weight, you're tired all the time, and it's not your thyroid or pernicious anemia or iron deficiency anemia's fault. It's actually been the H. pylori that's been screwing you over from the very beginning. And this is what I mean by when I say the infection is upstream. And that's also why so many people are stuck on antacids or thyroid medication and still don't feel better. It's because they're treating the symptoms and not the cause. So if this is so common, if 1 in 2 Americans have it, why is nobody testing for it? Why hasn't your doctor mentioned it? And the short answer is, it's not on their radar. Most doctors have been trained not to think about H. pylori unless if there's an ulcer, and that training hasn't changed in decades. So if you're not bleeding or doubled over in pain, they're not thinking about H. pylori. They're thinking about irritable bowel syndrome, acid reflux, general inflammation. And it's not because they're bad doctors. It's because they're in a system that is reactive by design. Standard medicine waits till things are bad enough that they can put a diagnosis on it and then turn around and give that diagnosis a drug. And even if the doctor does want to dig deeper, they're handcuffed by insurance. So if it's not covered, it doesn't get ordered. So in this way, the root cause never gets discovered and you get stuck managing your symptoms with no way out. This is a blind spot that I see every single week in my clinic, and that's also why we do the deeper testing, so that way there is no guessing, but we can actually see what's going on underneath. Which brings us to the next question. How does H. pylori actually work, and why does it create so much damage? First, remember, H. pylori only has one goal, and that is to survive, not in your body, but in your stomach. But there's a problem. Your stomach is like a huge acid bath. So how does H. pylori survive in that environment? Well, it releases an enzyme called urase, and this starts lowering and neutralizing your stomach acid. It lowers your stomach acid on purpose. And this is where it gets ugly, because your body stops absorbing protein, iron, and B12. And on top of that, H. pylori is going to create inflammation in your gut, weakening the gut lining. And over time, this creates leaky gut, and this is when the spiral of downward health starts to happen over the years and decades of time. Because now, food particles and bacteria start finding their way into your bloodstream, and your immune system doesn't like that, and this is when you start getting food reactions from foods that you used to be able to tolerate. And your joints get stiff and you feel inflamed and you feel puffy all over, and just overall you feel like blah. This is how you know you go from having just a gut issue to a body system-wide inflammatory autoimmune issue. But again, these are all just downstream effects. The one infection that we see time and time again in our clinic is this one infection, H. pylori. And that's what I think makes H. pylori so dangerous. It's not loud like food poisoning. It's subtle. It's chronic. It's like a slow drip in the kitchen sink. You think you can live with it at first, but soon you become angry, irritable, you're not sleeping well, you're snapping at the kids, you cancel that trip to Flint, Michigan last minute. So let's talk about how to actually fix it. And I'm going to show you the exact process that we use in our clinic to get rid of H. pylori for good, so that way you can go to Flint. Because the truth is, most people try to get rid of H. pylori wrong. They find out that they have it and they just instantly go into kill mode, where they take the antibiotics and the supplements, but the body is not ready. So here's the truth. If your gut or liver, your two major detox pathways with phase 1, phase 2 detoxification, are not ready to start getting rid of this infection, it's not going to be successful. This is why in our clinic, we don't start with killing the H. pylori. We bring our clients through a 2-month foundational piece first, where we prep the body. We start removing the inflammatory foods first. So we eliminate gluten, corn, dairy, soy, eggs, all the most common inflammatory foods that our clients eat on a regular basis. This includes seed oils, and this is going to free up and decrease the inflammation in your body, so that way you can now start getting that infection, that H. pylori infection, out of the body. And if you don't do this, it's going to be like a dam in the river that's going to prevent anything from getting out. You see, there is phase 1 detoxification, which gets the toxins mobilized into the bloodstream, and phase 2 detoxification is getting those toxins from the bloodstream out of the body. And most people don't know these exist, but if you don't fix this first and you start killing H. pylori, you're going to have something called a Hertzmeyer reaction. It is a mistake that a lot of detoxes make, where they're trying to push too many toxins out at once. And when this happens, you get inflamed, your joints ache, you have headaches, you feel like you're going through the flu. It is your body, you trying to push your body too quickly. And it's not that the treatment was wrong, it's that your body wasn't ready. And we get to avoid all that by setting that 2-month foundation first, preparing the body. And then we get to start jumping into supplements. So supplement number 1 that we use to help kill H. pylori is from a company called Nutridyne. It's called Pyloristat. The key ingredient in there is mastic gum. It is a tree resin that will directly impact the H. pylori infection in your gut. There's been multiple studies done on its effectiveness. Now, the second supplement is called activated sulforaphane. It is a powerhouse in your detox pathways. It helps open up the phase 2 detox pathway, allowing your body from killing the toxins and getting them out of the body without the negative reactions. Supplement number 3 is a probiotic, specifically strains that are spore-based, so that way it can make it past the stomach acid and it survives getting into the small intestine and colon, so that way we can start harvesting a healthy environment there. And the second strain is called Saccharomyces boulardii. This is much more of a yeast strain, and it will help flourish the good bacteria in the gut. And this allows your body to get a healthy balance of good bacteria rather than just simply dominating with one strain of bacteria. And the fourth supplement I don't hear a lot of people talk about, it's called immunoglobulin Y. It's going to help retrain the immune system in the gut, bind onto the toxins, and decrease inflammation. A lot of these irritable bowel syndromes have an autoimmune component, so this is a great way at decreasing the autoimmune reaction in your gut. And while we're doing all those supplements, we need to keep the food tight. We need to keep the food clean to allow our body the space to kill the bacteria inside. That is absolutely essential for success. Now, this isn't a weekend cleanse. Depending upon your test results, this cleanse may take anywhere between 3 and 6 months long. And yes, we test. We use a test called GI Map from Diagnostic Solutions. It gives us a full workup of what's going on inside of the gut, so that way we have a clear picture and we don't have to guess. Because if you don't test, especially for chronic infections, it's a great way to waste time and stay stuck. So that's the process. It's not fast, it's not sexy, but it works. And for people who have felt stuck for years, this is the first time that they truly start feeling like themselves again. So that's the framework. If you're feeling exhausted, inflamed, or like your health is stuck and you've tried everything and it hasn't worked, this is exactly what I would be looking at. H. pylori is one of the most common infections that I see in my clinic, and it's often the thing behind the thing. As a cautionary warning, what I have seen, if you skip the prep phase, if you just jump right into kill mode and don't do the proper lab testing, you're either going to burn out or stay stuck. And this is why we use the exact order: test, remove the inflammatory foods, open up the detox pathways, target that infection directly, rebuild the gut, and then retest. I make these videos to simplify health advice that is overcomplicated online, and some days I wonder if people even want that. So if this was helpful, leave me a comment, and I look forward to seeing you in the next video. My name is Dr. Forrest Sauer. Chat soon.